now to our next presentation. We've invited our current moderator of the Presbyterian Church of New South Wales, Adrian Lamrock, this evening to share a little bit about what's been going on between government and leaders of faith groups in the community. Adrian's joined by Jeof Falls, our General Manager, who's also been instrumental in engaging with government and interpreting government restrictions and regulations so that we as congregations can get on with ministry in our communities. Adrian and Jeof, welcome, and I'll hand over to you if you just share your screen. Thank you.
Thanks, Amy. I'll take up the reins and then Jeof will take them over. I became moderator just over 2 months ago, and since taking up that role, I've participated in 3 forums for leaders of faith communities, which have been facilitated by the Department of Multiculturalism. The Minister for Multiculturalism, the Honorary Natalie Ward, has always been present, and she's spoken at those and has responded well to concerns that have been expressed. She's been accompanied by Dr. Jan Fazell, who's a Senior Medical Advisor in the area of public health, population health rather, with the New South Wales Department. And more lately, Assistant Police Commissioner Anthony Cook has been part of recent meetings. Participating with me in those forums have been Jeof, our General Manager, and the Executive Manager of Corporate Services at Church Officers, Peter Merrick. They've both been attending the forums much longer, and in fact, they commenced back in the middle of 2020. Jeff's going to speak at great length about what's happened during that time, but I'd like to have a couple of minutes and to say that even in my short time of participation, I've got the strong sense that the views and the opinions and concerns expressed by different faith communities at these forums are being treated seriously and sympathetically. All faith communities around New South Wales are welcome to attend, and a very large number do. There have always been at least 70 groups represented, and in more recent times, up to 200 participants have joined in, both from metropolitan Sydney and regional New South Wales. As well as these forums, we have been able to have regular contact with Service New South Wales, who have been incredibly helpful in providing explanations, answering questions and clarifying issues. And some of you who are here tonight will have been able to hear the responses that they have given when people, and particularly Peter Merrick, have made these inquiries. While there's been a huge range of beliefs and of communities represented, there's also been a real and sometimes surprisingly common focus on the issues facing people of faith. It's my impression that we're being listened to. Faith communities have underpinned government decisions because of common characteristics we have, such as a focus on individuals and local communities, a strong informal and formal networks, each being internally united in their common purpose. And in that purpose, they are focused on protecting the vulnerable and those in need. And I've heard some great examples over the forums I've participated in of how people are doing that. And of course, faith communities are trusted in their communications within their own communities. And that's been really important in getting messages across. During the last forum which I participated, more than 160 questions were put to the Minister. And I know that the 2 that I asked were certainly answered during our time on screen. She has been addressing the others since then and will bring responses back to the next forum. And in fact, each forum has brought responses from questions at the previous one. Issues such as COVID-safe wedding ceremonies and the allowance for religious practitioners, and for us that reads ministers, being allowed to cross LGA boundaries in certain circumstances, have certainly been matters that were widely raised and have been acted on by the government, I believe, certainly in part to those forums. I'll ask Jeof to take over now and take us through the rest of this presentation.
Thanks very much, Adrian, and welcome all. It's terrific to see you on screen, having communicated with many of you over the last 12 months through our COVID updates. Peter Merrick and I have had the pleasure of working closely with now 3 moderators during this pandemic: Richard Keith, Andrew Campbell, and now with Adrian. It's been a challenging time for each moderator as COVID circumstances and restrictions have changed so quickly over the past 20 months. Indeed, there's been weeks there where Peter and I and the moderator at the time have really worked hard just to keep up with the changes. Throughout that time, we've found the New South Wales Government and New South Wales Health disciplined and consistent in their approach. I think that's important for all members of the Church to be aware. New South Wales Health is genuinely concerned for the health and well-being of all citizens. And I remember the day, the forum, when Dr. Jeof Falls spoke for the first time of the Delta variant having reached Sydney. And I came home that night and said to Jan, my wife, I said, she is very concerned. There was a distinct shift in the tone when Delta arrived in Sydney, and it was clear that New South Wales Health was, with one person only having caught it, very concerned at the infection spreading. And indeed, it was from that one that we are now here today, where we've seen it spread so quickly, as Nalini has explained. I will speak about Dr. Falls because she has been involved in every one of the forums over the last 20 months. She's a trusted senior advisor to the government. She's very personable. She comes to every meeting and she answers all questions. And at heart, she's a doctor who is concerned for the vulnerable. She's gained the trust of all faith groups over this period of time. She is open and transparent, inclusive and collaborative. And it is quite clear that the decisions of New South Wales Health and the government, the Premier herself, are driven by their concerns for the health and safety of all people. These are not political decisions. These are not trying to make decisions that are contrary to other states. They are driven solely by the health concerns. And I've enjoyed listening to Nalini tonight because what we hear within the forums is very much what's been reinforced and explained to us by Nalini tonight. It is also clear that Dr. Falls is representing the Premier very well. She does listen. Multicultural New South Wales listens to all the faith groups. They do seek to respond to the differences. And I would like to emphasise this, is that we have particular views about church and of course singing. But I want to assure everyone that all faith groups have similar concerns, whether it's singing or chanting or rites. What has come through clearly in the last 20 months is the commonality of concern and appeal to government to support worship. I'll just move to the next slide. New South Wales Health has stated on several occasions now, as Nalini has also explained, that they are particularly concerned about two things. One is new COVID variants, which Nalini has spoken to, and it's clear that New South Wales Health is not only concerned about Delta, but indeed what may come after Delta and the impact on our society of a new strain. The second concern they've expressed clearly to all faith groups is the waning of vaccine immunity, which again, Nalini has explained very well tonight. We see these concerns emerging in several countries, and New South Wales Health is clearly monitoring those countries to see the impact on Australia. For us and across faith groups, it is quite clear that our concern is if our own people fall ill, if the illness closes worship services, if the infections lead particularly to serious long COVID illnesses within our faith communities, within our churches, and ultimately our fear and our concern, our deep concern, is that if our people, our own people, die from this disease. We are all particularly focused on the most vulnerable because faith groups have the most vulnerable as part of their faith communities. And it is quite clear through the 20 months how, despite the fact that there's a multiplicity of different faiths coming together, there's a very strong common approach. The final slide, I just wanted to spend a moment just to reinforce the key priorities that New South Wales Health communicates through all the forums. And Dr. Fussell herself just simply repeats these. So they become a bit of a mantra. But indeed, Peter and I seek to reinforce this when we reply to the inquiries that come to us from different congregations. And they are, and keep these at the top of your mind, New South Wales Health throughout the whole of the 20 months, as Nalini has highlighted, reinforces hygiene and cleaning. So no matter what happens, maintain hygiene and cleaning within your church. They reinforce safe food handling at all times. They reinforce social distancing at all times. They reinforce mask wearing at all times. So as the pandemic shifts and changes, as Nalini has explained, just keep in the back of your mind in your own church, your own community, keep those 4 things at your forefront. Contact tracing has been important. My sense is that whilst Nalini has highlighted that it will continue, and clearly it will in hotspots, is that it appears it'll become less important in this as the vaccination rate goes up. And so I do expect that to change in coming months. As we all know, in the knowledge that infection rates will rise with the state opening up, New South Wales Health's current absolute focus is to increase vaccination rates. And what they're attempting to do is reduce the expected load on hospitals in our health system, as Nalini again has explained so well. And I'm sure that Peter and I will be very busy responding to many questions from congregations in coming months, and we just encourage you to keep contacting us. We have people ringing us, we receive many emails. Peter is our in-house expert, and we're here to help you navigate these changes within your congregation. Thanks very much. It's a pleasure to be here tonight, and I'll now hand it back to Amy.